Let's bring in Jennifer Haberkorn now. She is a healthcare reporter for Politico, and she joins us now from our Washington bureau. All right, so Jennifer, we know Senate Republicans really trying to push this thing ahead and get a vote on this healthcare bill before the 4th of July recess. But really, what's the reality of that?
You know, it's going to be tough. Clearly, Mitch McConnell wants this vote in the next 10 days before that 4th of July recess, but there's a lot of things working against him. A lot of Republicans, they're still divided on a couple issues. There's Republicans who are concerned about the process that's going on here. And, you know, we don't have legislative text. We're supposed to see that before the end of the week, but it's unclear whether Republicans are going to vote for something that they've only seen for a week, maybe, you know, even a couple of days.
Jennifer, I don't know if you were in the Rose Garden after the House passed their version. I was there, and it was quite a huge celebration. It was very reminiscent of Mission Accomplished, that banner that President Bush put up. I'm just curious, you know, what kind of pressure are they under if they can't get this through?
Huge pressure. I mean, that Rose Garden ceremony, you're right, it was kind of mission accomplished, but it was only a portion of the process. I mean, getting this bill through the House was a big legislative accomplishment for House Speaker Paul Ryan, but, you know, they're going through the same problems in the Senate right now that they went through in the House. I mean, in the Senate, Republicans are still divided. A lot of these issues are being repeated in the upper chamber. And, you know, will there be a Rose Garden ceremony where this bill is actually signed into law? We just don't know at this point, and I don't think Republicans know either.
And obviously, we've been hearing from Democrats who are very upset about the secrecy of this process. But it's not just Democrats who are upset over these sort of closed-door dealings, right?
That's right. There are 13 members of this working group, these 13 Senate Republicans. That group has since been expanded to all Republicans, but there are several rank-and-file lawmakers who say that they feel shut out of the process. I've talked to several Republicans who say this shouldn't be written behind closed doors. Even Orrin Hatch, the Senate Finance Chairman, on Thursday said he hadn't seen legislative text, and he's in charge of health care. He has jurisdiction over health care. So there's a lot of folks who feel like they don't know what's going on. The question is going to be whether those concerns are big enough to vote no, or big enough to go to Mitch McConnell and say, you know, let's give this a little more time. We don't want to vote before 4th of July. Let's have this marinate out in the public a little bit longer.
Jennifer, just 3 Republican senators need to vote against this bill to stop it. Is it possible that there could actually be 3 GOP holdouts?
Very, very likely. I mean, as of right now, there's, you know, 4 Republican senators who have voiced big concerns. There's others who have voiced, you know, relatively big concerns as well. So the question is going to be, you know, whether they actually make that a no vote, whether they go to McConnell and ask for the vote to be delayed. And we just don't know how close that is right now. A lot of Republicans are hesitant to draw a firm line in the sand because legislative text isn't out. That being said, you know, this bill is not very popular. Polls show it has less than 20% support. So, you know, all of these things are going to come together this week, and if they turn into yes votes or no votes is still yet to be seen.
All right, Jennifer, we know you don't know exactly what's going on behind closed doors here, but through your own sources, do you have a sense of what sticking points there are, even amongst Republicans, when it comes to this health care bill?
There are still major policy divides. One of the big ones is the Affordable Care Act expanded the Medicaid program, and Republicans want to roll that back. The question is how soon. Several of the moderates are concerned about throwing people off their coverage right away. They want to see that repealed over a very long period of time. Conservatives want to do that more quickly. They also want to cut the Medicaid program overall, and the question there is how aggressively to do that. So there are still several sticking points that the GOP is divided on. They're trying to hash those out in those closed-door meetings. We know the broad outlines, though. There's still a lot of division among Republicans.
All right. Politico's Jennifer Haberkorn, thank you.
Thank you.